Hey, we are here today and we are talking about something that I'd never heard of. Perhaps you haven't either. It is something that is called cherry eye, and it happens in certain breeds of dogs. And Dr. Jerome Williams, our regular guest from Red Mountain Animal Clinic, along with Dr. Susan Nelms from Veterinary Eye Care, she's a specialist, joins us this morning to talk about it. Good morning.
Good morning.
Good to see you. And who do we have here?
This is Sammy.
Sammy's so cute. Sammy's so Sammy's your dog?
She is my dog,
Okay,
and she
so
is
we don't-
one of the breeds that can have cherry eye.
And so what is cherry eye?
So dogs have two tear glands, the main lacrimal gland like we have, but then they have a third eyelid. Most people don't know that dogs have a third eyelid, and behind that third eyelid is another gland that makes tears, and it's called the gland of the third eyelid, but sometimes it can pop out, and layman's terms, cherry eye is what it's called, and I think
So
we
it
have some
pops
pictures
out.
of that.
Yeah, we do have some pictures.
It
We'll go
can
ahead and
just
put
like
those up.
spontaneously pop out.
And it doesn't go back
And
if it pops out?
Sometimes it does. This is just an example of the third eyelid in the dog.
Okay.
And so a lot of people say to me, I had no idea my dog had
Yeah.
a third eyelid. And that's just a puppy showing the third eyelid coming up a little bit.
sweet
That's
puppy.
not the actual cherry eye.
Okay, well, let's move to the next picture
And
then.
there's a mastiff puppy with a cherry eye. And so that's that
Oh my
gland
gosh.
prolapsed out. So some
So
breeds,
it's pretty prominent. You can see it.
it's
then.
usually very obvious.
Yeah.
And sometimes it will initially kind of pop in and go out, in and out. And then once it stays out, it tends to stay out.
So what's it doing? Is it
And
hurting them?
It's really not painful. It might be a little bit uncomfortable. It's not an emergency situation. But if it,
And that's the big
and
thing.
that's kind of scary for owners when they see that and they think, oh my gosh, it's an emergency.
Right.
But it's not.
Okay, so what if you see something like that in your dog, Dr. Williams? Do you take them to you or your
Yes.
regular vet first? And
Regular vet first,
Okay.
usually.
Yes, and Dr. Nems, being an ophthalmologist, has a surgical procedure where she actually goes and tuck that gland back underneath that third eyelid. So it's not exposed and it's not going to be all infectious, and possibly, I guess if it stays there a long time and dries out,
That's right. It doesn't function as well.
Can they pop out again after you fix them?
They can, but it's very successful surgery. It's really pretty uncommon. It's got like a 97%.
look at this little
This
baby
is like a little
here.
Boston puppy that had, and then there's a picture of him afterwards. So typically with the surgery, we reposition the gland. There he is right after, back in its normal position.
and a third eyelid is sort of a protective mechanism for animals, is it?
For the eye, so it is like a protective mechanism for like a little windshield wiper.
Okay, well, you have enlightened us today about something we did not know about, and hopefully you won't see it in your dog, but
right.
if you do, then you know what you're looking for.
That's right, that's
and
right.
don't have to panic because we love our pets so much.
Now, treating it, usually not successful, and with antibiotics and anti-inflammatories?
Sometimes if it's really mild and they're on an anti-inflammatory eye drop, it might go back in and you might be able to avoid surgery. It's those cases
So do
where
you try to avoid surgery
you do,
first?
You try
Okay.
that first. So try medical management first for sure. And then if that's not successful, then
Okay.
surgically putting it back in place. Never want to surgically remove it.
Okay, have you seen many of them?
Oh, yes.
Have you a
It's,
lot?
Quite
it's
often.
pretty common.
Okay.
Yes.
All right, well, thank you both.
Thank
Good
you
to
for
see both
having
of
me.
you. And now let's